Florida, Brittany from Pennsylvania. We have Dr. Eric Pepper from San Francisco. We have Dr. Elenor Criswell from Tel Aviv in Israel. We have Patricia Valencia Carrillo from Madrid, Spain, and Dr. Marilyn Safir from Haifa in Israel. There may be other people coming on as we go, so that we are going to now turn it over to our honored guest, Dr. Elenor Criswell. And I've known Dr. Criswell for many years as one of the founders, really, of humanistic psychology, of somatic psychology, and we're really honored to have her here today to talk about her work. One of the things that really interests me about her work, and I'm looking at others on the screen so that many of us here are animal lovers. We've had many discussions about humanistic psychology, and if that pertains only to the human animal. And some of us feel that it should pertain to all species and that we're all interconnected. So that this will be an unusual presentation. Dr. Criswell's been working with human animals for many, many years and has lately started working with other species as well to work with mitigating effects of trauma and stress on our fellow creatures around the globe. So here is her presentation, and delighted to have you with us.
I am delighted to be here because I am so happy to talk about this work with other animals. So I started out working with horses because a friend of mine who's a horse whisperer had invited me to work with his humans using somatics. And then after a while, he said, do you think it could be done with horses? So I said, maybe or probably. And then I went home to figure it out. And I did figure it out. And I came back and tried it with one of the thoroughbreds there at his ranch. And this horse, whose name was Tristan, responded immediately. And so I knew immediately, yes, in fact, it did work. And yes, in fact, it was very important and very special. So I then further worked with horses. I've been a horse owner for many, 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 many years and had a great appreciation for horses. But as I was working with them and experiencing them responding, I then adapted it to dogs. And, and so I teach dog owners how to do it with their dogs. And it has a profound effect on the human being who is doing it. It has a profound effect on the dog, but it also has a profound effect on the human being because we are joining in with their nervous system. We are becoming one with them. And And especially horses are more coherent as somatic beings than we are. So as we are achieving union, so to speak, with the horse, we are moving in that direction a little bit more ourselves. So I am so aware of the amount of stress and trauma in the world now, as you all are, very, very clearly. I work in a medical practice 2 days a week in Walnut Creek, in which I'm working with many people and experiencing their bodies as they have been coping with COVID and the whole issues around it. And the effect is very dramatic. Even the effect of them, of the stress, anxiety, fear, uncertainty, confinement, not knowing what the future holds, job changes, and all of those things. But along those lines, I also became aware of the fact that their animals empathize with them. And you already know that. Your pet is resonating with you and having an effect on, most of the time it's very relaxing and beneficial, the effect that they have, the unconditional positive regard and the whole very humanistic thing. But sometimes if they're not well, or if they're anxious or if they're afraid, it can also make you more anxious and afraid. So when I can, I like to work with both the human being and their pet, their companion animal, and to show them how to do it if it's feasible. And for some people, it isn't for health reasons and so forth. But I like to help them. I did a canine workshop recently on Zoom, and there were about 30 people there from different parts of the world. They all had their dogs. So imagine a screen full of 30 people with their dogs. It turned out later when one of the persons turned on her camera that she was working with her cat. So if your cat is used to being handled, which some of them are, they can also do this. But many cats have a very strong withdrawal reflex. So if you start to handle a paw, they've got to take it away. So dogs and horses, and actually one person there started working with her bird. So you see, all animals, all vertebrates do something called pendiculation. And you're probably beginning to hear that word now. And we do it when we yawn and, so to speak, stretch. Other animals do a whole lot of downward dog and arching the back and extending limbs, and they are handling themselves somatically. They are somatic, they're kinetic beings, so they are taking care of stiffness. They do it after they eat, they do it after they sleep. Foals do it 50 to 80 times a day. As they get older, they do it less frequently. They will not do it when they're ill. As they begin to get better, they will start to do it. But we humans aren't as likely to do it. We have yoga, which has helped enormously in the world, and it's sort of one of the forms of pendiculation. I am from the Feldenkrais lineage by way of Thomas Hanna, and I use this with my clients when it is appropriate, and it has tremendous benefits. I have a number of, we have a number of clients who aren't psychotherapy clients. They're coming in purely for somatic issues. So I have both psychotherapy clients and somatics clients. And whenever possible with the psychotherapy clients, we also do some somatic work because we are embodied beings. We truly are. So are our pets. And they have tremendous messages for us. I did train in one of the horse therapist approaches called equine guided education. And that in that you use the horse kind of as a co-therapist, and the horse is really the therapist. The human practitioner is kind of guiding and receiving and helping the person make sense of it. But my work is primarily horse or animal centered. So it's devoted to helping the animal move more freely, more comfortably, turn the clock back a little bit. Let's have a younger dog. I saw a dog yesterday that we had worked with. I had guided her over Zoom with her dog. Her dog could not walk very well. He could not stand very well on his hind legs. They were very contracted and very narrow based. And after she worked with him a little bit, he could stand more on his hind legs. And she said sometimes in their walks lately, and she hasn't worked with him in between, some of their walks lately, he's wanting to run. Well, I know he couldn't do that before she worked with him somatically. And she showed me a little bit. He needs more work, but he is walking much better on his hind legs. So this work is also developmental. So as you do it with the dog or the horse over time, they get more able to move, more comfortable, happier, younger, a whole bunch of things, and it's relatively fast. So it's not something you're going to wait Like psychotherapy, you can sometimes wait years to see the effects. You see little effects, but you don't see like huge change following one session. So it's really incredibly exciting to do. It makes a person very happy. I currently I'm sharing a Mustang. Her name is Espy, and she has the beginnings of something called ring bone in both of her front legs in the pastern area. But with our equine somatics work, she can move more easily and comfortably, and they're making some changes and getting the right medication for her. But she is a profound teacher. So they all teach a great deal, teach us a great deal. We don't always consciously know exactly what they're teaching, but sometimes you can get a hint of it later. For example, my work with horses has opened up the whole world to me of the other sentient beings by way of working with these beings and getting a sense of them and sort of getting a sense of everybody because they're all out there, sentient, marvelous. I read a book recently, which I recommend highly, called Beyond Words. Um, the last name is Safina, Safina. And it's wonderfully looking at elephants. I do want to do elephant somatics at some point. I'm putting feelers out for elephants, but haven't succeeded with that yet. But any vertebrate actually can do it if they are capable of responding to you without being frightened by you. But it can be done with all kinds of animals in the right time, in the right moment. So horses are, because they're prey animals, they are extremely sensitive. They are sensitive to tiny changes in the environment. Their eyes are set up so that their rods, the whole area, not the center, the cones, is where they're picking up the changes in movement. And they have a lot of territory devoted to that. Um, and that comes into a part of the brainstem called the superior colliculi, and the animal is startled by it and ready to run. So they're very sensitive to everything, sound changes, movement in the environment, your mood, many, many things. And so because of that, they make great biofeedback, organic living biofeedback devices. If you are more coherent, they want to be near you. If you're not, they want to be somewhere else. And as you become more coherent, then they want to come near you. And they are pleased with your touch and they are extremely responsive. And because we care about them, we really want to be someone they want to be near. So we kind of come into attunement with them. We kind of resonate with them. And after we're with them for, let's say, an hour, we leave with a slightly different sense of ourselves somatically and of the world and of our moods. And so I invite people nowadays, I invite clients and various people to come up and visit SB. So they come up for a visit, they spend time with her, maybe they do some grooming and so forth. And they get a chance to resonate with this very coherent, sweet, kind, very intelligent, very intuitive being. She is very special, and many, if not all, horses are also special in their own ways. They're very individual. They have different personalities. Have different hemisphere dominance. They are their own unique beings, and we can benefit a lot from being with them. Now, dogs are predators, so they have a different makeup, but they have many of the same same ways of being structured physiologically, brain-wise, and so forth, except the predator dimension in there. Um, and but they are animals just as we are, and we can learn so much from them. Nowadays, there's more research going on in terms of their intelligence and what all they actually can do. One of the things that Safina points out, which I totally agree with, we used to not want to anthropomorphize our animals. Don't project on them human emotions and ideas and so forth and so on. He is saying, and I also would say, please do anthropomorphize. When they are happy, they are happy. When they are sad, they are sad. When they are helping, they are actually helping. It's not just a coincidence, they actually are helping. And there's so many things that you can backtrack into. It seems to me that this dog is feeling such and such. Just in humanistic psychology, we don't want um, non-accurate empathy. We don't want to project on other people things that they actually aren't feeling and thinking. But we do want accurate empathy with humans and other animals. If you have an animal that's kind of sympathizing with you, accept it as sympathizing with you, understanding, kind of getting the point on your distress and so forth. So anyway, um, so we wanted to do a little demonstrating. We did. Was that something we wanted to do, Eileen? Yeah. Okay. So
Yes, a number of us have brought animals and they're here today. We're so eager.
I
I
am
think
so
there's
glad.
a lineup,
Oh,
probably.
good.
Yeah.
I am going to sort of jump ahead here. In the workshop, I would give you lots of understanding about conformation, so you can look at before and after, and brain structure, and what part of the brain were you asking the dog or the horse to use to do the work. We are actually asking them to use their brains to change what's happening with their muscles. So you are working together, so we don't say work on the dog, we say work with the dog, because it's your dog's brain that you are interacting with and asking your dog to do something. So what we do, the basic, there's three different techniques that are part of somatics. One is called pandiculation, but it's a voluntary pandiculation. It's not a stretch or, it's not a polysynaptic reflex. It is voluntary. You are asking for something and you are asking, yes, Giselle. So we start with the legs because the legs are run by all of the muscles that are up in the shoulder are in the hind end. Below the knee, it's only tendons. So we're really working with a lot of muscles in the rest of the body when we're working with their legs. So we first of all, we ask the dog, horses can do this standing up, and it's very handy that they can do it standing up. But dogs usually prefer to lie down, and if you are holding the dog, then you have another way of working with their limbs. So I want to show you with yourself first. So if you will imagine your right arm is a leg, and you ask yourself to pick your leg up, to pick your arm up. So you're going to pick it up. Now, very gently, you're going to invite your arm with your other hand to slowly come down. So take your other hand and just kind of gently feel with your other hand that the hand that's doing the work is slowly coming down, and go with that. You're not going to push it down. You're suggesting that it go down, but you're feeling it going down. And as it goes down, you go with it all the way down, all the way down. If you're a horse, you'd put your hoof all the way. Now, a dog can do this sitting up, can do it standing up, can do it lying down, can even do it lying on their backs. Whatever position you can invite a movement and then invite the dog to come out of the movement very slowly. Now, many animals will want to go quickly because that's what they're used to, but you're inviting it to go slowly down. And what you're doing is asking its brain to gradually decrease the output. There it's up. Now slowly invite it down, coming all the way down. So when you picked your arm up, you used all your shoulder muscles, or a lot of them. And as you came down, you decreased the output to all of them, allowing their muscles to lengthen. You're actually asking them to inhibit the firing of motor units, which is too much information. And you do that about 3 times. So it's up and then slowly coming down. And it actually is very pleasant. And dogs, once they get a sense of it, they really love it. And by the time you finish working with all the legs, with their backs and necks and tails and so forth, they are very relaxed. So Giselle, what is your dog's name again? It's Bronx.
Yes.
And Patricia, what is your dog's name?
Tail.
Is
Tail is my dog's name. Tail.
Tail.
Yeah.
Okay. And then we've got, I'm not sure whether Brittany's name that's the name of the dog or the person.
My cat's name is Shoes.
Cat Shoes. Okay. And then Elenor, do you have a dog with you there? Okay. You can enjoy the other dogs here. And Mary, do you have a dog there?
I have a dog. Her name is Coco, and she's 11. And actually, this is very relevant to me because we were at the vet's this morning, and she was X-rayed. She's having some problems with her lower spine, and she got 2 shots, and now I'm giving her pain medication.
Oh, it's very relevant. Very, very relevant. So when you're working with a dog's leg, you pretend, even if they're lying down, you pretend like they're standing up just to get the orientation. So you're going to invite the dog to bring, if you're working with the front leg, going to bring the dog's elbow back toward its spine and then slowly coming back down toward what would be the floor. So you've got the elbow going up toward the spine. And for you, you could take your elbow back and slowly let your arm come forward. It's the same kind of thing. So we're taking elbow back and slowly coming back down to the floor. So you do an initial pickup all around. We want to do all 4 legs because we want balance. When they're running out and about, we want all legs ready to meet the earth in the same way. When we're working with the hind legs, there's a part in the back, which some of you, if you aren't dog owners and aren't familiar with dogs, you won't necessarily recognize. Can you turn Bronx to the side for us? Okay, very nice. Can you pick up one hind leg there? Okay, can you see? That's his knee going up toward his back. The sort of beige color right there is called the stifle joint, and that is his knee. So you bring that up toward the spine first, and then slowly let him straighten his leg. So straighten down toward the ground. Great. Without pushing. So you, with your hand, you invite it and you feel it responding, feel him responding gradually. His leg gets longer. but you're not going to push it down. You're just suggesting and feeling it lengthening. And he is so good. Okay, that right there was a little reflex. So if you go too fast or too far, you'll trigger a reflex. And it is very cool to watch. And that will say that a muscle got stretched, it triggered the stretch reflex, got picked up again. If that happens, start over, just slowly coming down. And people are enjoying watching that. Giselle, great. So those are the initial pickups with all four legs. Then, depending on how the dog usually stands, the next move will be to bring the limb forward. So does he stand with his leg coming back behind him or coming under him? Do you remember?
I'm not too sure.
Okay, well, let's imagine that he's standing under. So you're going to do the initial pickup. Just going to check and see. She's going to show us. Okay. I would say a little standing under here. Now, maybe because he's on a chair, but let's just say he's standing under. So the first move you would do would be going forward, which is called protraction. So you do a pickup and invite him to bring his leg, and he's going to do it for standing up. Bring his leg forward a little bit, coming toward the front, and then slowly back. So you only go as far, no, not that far, back to neutral. Great. So it's a pickup. You come forward as far as he can go today, and then slowly back and slowly down. Very good. And if there's a lot of moving around, that's okay. Coming forward and then slow. He's taking it, or he's allowing it farther than most dogs will want to go, but he's very good at that. So we do about 3 repetitions. Horses can count to 3, dogs can count to 3. They know when you've done 3. Okay, slowly back and slowly down and down. Great, that's wonderful. So then you're going to want to do that. Dogs usually, since they want to lie down, you generally have to do it all with one side before you can do it with the other side. So Giselle, let's show retraction. So you do a pickup and invite him to bring his leg behind him. So the pickup is knee toward his back and then coming back behind. Okay, stretch reflex. So he can't go right now any farther than that. So stay in that zone there. Picking up, coming back. Good. Oops. So don't go that far, just back a little bit. And now he's wary. So he's contracting muscles to keep his balance and so forth. So anyway, going back as far as he can allow now, and he'll let you know when he can't go any farther, like with a stretch reflex. But otherwise you may just feel it can't go any, that's good, and down. So you only want to go as far as you can easily and down. And so let's try the front leg. So in this case, you're going to invite him to take his elbow. Can you show them where his elbow is? It's up near his body. Then now he's showing you his elbow right there. Okay, so now that's the pickup. Now invite his leg to come back behind him. Good, and slowly bend again and come forward and slowly down. Excellent, excellent. So he's used a lot of muscles of his shoulder to do that. And he has contracted them, and then he has decreased the output to them to allow them to lengthen and come down and support his body. So, okay, you want to do another one? So, great, and slowly down. Okay, let's do it again and come back behind you. So we're going to retract and then coming forward and slowly down. If you palpated his body, his shoulders and his hind end before you started, you will feel the muscles being much more resilient or softer. And that means he can use them more. So as a dog gets older, it frequently gets stiffer and stiffer. And as you do this, those muscles can be supple again. He can use his hind end again, et cetera, et cetera. Okay, so I think that could have been 3. Is that a bow ribbon he has?
Yes.
That's great. That's lovely. Okay, let's go forward now. That's going to be protraction. So invite his elbow to come toward his back, and now coming forward, and then don't go too far, and then bend and come back down. He's checking it out now.
Said, what are you doing?
Yeah, what is that, and how are things? Okay, so again, you don't have to go that high, actually. That's
Nope.
good. Just enough off the ground and forward. Great. And slowly back. Great. So that's protraction and retraction. The next thing is adduction and abduction. So I think, does he stand with his legs a little close together? I know the hind end is a little abducted, especially right now. How is his front end when he's standing?
Fonzie?
So he's going to show us. Okay. I'd say they're a little
Close.
base narrow here. Okay, but not too badly. So now you're going to do the initial pickup and invite his leg to come in toward his body. Yep, and slowly back out and slowly down. Now he's working with his adductors. For you, it would be like your pectoral muscles and so forth. It would be just like your pectoral. You bring your arms in and slowly coming back out, you will have voluntarily contracted your pectoral muscles and then voluntarily allowed them to lengthen. Okay, so we want to do 3 times. Pick up and coming in toward his body. Now, when you're getting fancy, which we won't do today, you'd have a repetition where you bring his limb in front of the other leg. And then another repetition will be behind that other leg. So you're getting different parts of his pectoral muscles. But we're just going to do that. Have you done 3 there, Giselle?
Yeah.
Coming in toward his midline and back out. And don't put it down in between. Just bring it in, bring it out, and bring it down. So it's going across to the other side. There you go, and back out, and don't put it down unless he absolutely insists on it.
Yes.
So did he insist on it?
Yes.
Okay, if he insists on it, he's the boss.
He is the boss.
Okay, so we also need to adduct the hind end. And Giselle, if we don't get to all these for all 4 limbs, we're going to need to have you do them afterwards.
Absolutely.
Okay, so we can already see. Can you turn him around so we can see the front again? Move both legs. He's sort of planning them and keeping them there. Alrighty, but if we saw him standing freely, we might see his right leg going out a little farther than the left because we have freed the adductors on that side. By the way, I do have a DVD of this. I think it's also downloadable. I have it on MP3, downloadable, and DVD. In case you want to get the protocol, it shows me doing it with a small dog and a medium-sized dog. It can be done with any size dog, little tiny dog or a very big dog. You just scale it down or scale it up depending on your dog. So let's try the hind end. So you're going to do an initial pickup, bring his stifle joint toward his back.
His hind?
Okay, now you're sort of doing the other side. Can we stay with the side we were working with? Because we have done all those things with this leg. Now do his initial pickup, that is stifle joint toward his back, and now bring his leg across the other leg. Great, and bring it out. Don't put it down first. See if you can hold it up and then bring it out and put it down.
Pretty strong.
Hmm?
Pretty strong. Doesn't.
Well, that I see that. So if that is the case, let it go down, then pick it up and bring it out. And the reason why it's so strong is that the muscles are very contracted. And so he brought it out because that's a more stable base there. Okay. Because we do want it out in what it would be like neutral. He's pretty he's pretty quick with that. And part of the reason why he's quick with that is his abductors are so tight. So let's work with his abductor back there. So you're going to do the initial pickup, lift his leg out to the side, the whole leg from the hip all the way down, out to the side a little bit, and slowly back and slowly down.
He's looking at me like, okay.
So he's going back very fast because it's a reflex. Like that one's especially designed to keep him on the chair. And okay, that's enough. That's enough. Okay, how about the front limb? Let's abduct the front limb or the forelimb. So it's the whole leg. It's like you lifting your arm up out to the side and slowly coming down. So he's using his deltoid and his supraspinatus and infraspinatus and tricep and all those things, and slowly come back and down. So is that 3? Okay. All righty. So palpate his shoulders and his hind end and compare it with the other side. See what you can notice a difference between the muscles. So you're just going to kind of press in on the muscles.
It's definitely stiffer than the other.
It is?
Yeah. Well, the side that I didn't do, I feel like this one's a lot more flexible. It's softer.
That one should be more flexible.
Yes. This side is much more flexible than this side. This side feels a lot stiffer.
Mm-hmm. That should be the way it is. And when you do both sides, he will be able to move around, run around, do all kinds of things much more easily. In fact, you will see him spontaneously doing that. He might want to play more than he's wanted to play, and all sorts of things that you might feel. So you want to work with his neck muscles, and we might do a little bit with that. So, but depending on his starting point, it's a good thing to start with the lateral flexion of his neck. So invite him to bring his head toward you and then slowly back. There he goes. See? Smart. Now slowly back to the middle. Good job, Bronx. So he has used a ton of muscles here at the side of his neck, about at least 7 of them, to contract, to bring his head toward Giselle, And then to decrease the output, he's using his brain to decrease the output to those muscles to let him slowly come back. And once dogs have experienced this, they will come and ask you for it.
Yep.
Someone has told me recently about her dog drags his rug in to put it down beside her when he wants her to do this with him. Very good. Let's go to the other side now.
You want?
Can you see it?
Okay, so if he wants to take his head up, go up and then slowly coming back down. You can go with his moves. So he wants to go up, you're using the posterior, okay, now you're using the lateral flex, very nice. Now his head can go from side to side much more easily than previously. So was he taking his nose up? Take his nose up and slowly bring it down.
Yes.
So we're going to now use the muscles at the back of his neck. And slow.
Out of zone.
That's good. And wherever he is, slowly go down from there. In whatever version you can do. So we're also getting some back muscles with this as well. So it's take his nose up in the air and then slowly bring it back down. Yeah. And yawn. Yes, they will frequently yawn because it is very relaxing, extremely relaxing, because dogs are working hard all the time. They are running around, they're jumping, they're paying attention to what you want, what you're doing. They're taking care of whoever's come to the door and all sorts of things they are in charge of.
Spends a
Also,
lot of
what?
cartoons. Spends a lot of time watching cartoons.
I'm sorry, what?
Spends a lot of time watching cartoons.
Oh, really?
Yes.
Okay, well, cartoons are very exciting and can make a person or a dog more muscularly contracted. Okay, so we would work with his back, we work with his tail. And so what you do is you go with your tail. What position does he hold his tail typically in?
Now he has no tail. He has like a button tail.
Okay, so the thing is he does still have a tail. He has the stump of a tail and he does wag it. Every dog wags whatever they've got. And so the tail, what's left of it, is the end of his spine. So you want to work with it as if he had a tail. So it seems like his tail is clamped down. His tail is kind of not going up in the air. So you would start with that position, with invite his tail to go down, and then slowly up a little bit. Down and slowly up, slow. And then, depending on which side he's holding his tail toward, you would start with that side first. So if his tail, I don't know, it looks a little here like it's going toward the right. But so you start by going over toward the right. So that is the left. Is that how he's holding his butt tail? You would go whatever side he is holding it toward, and then back toward the center. Slowly. Go slowly. Thank you, Giselle. Good. Okay, now we're going to go to the other side and going slowly. Invite him to take it to the other side and back to the center. And there are muscles in the hind end that are devoted to those different moves. And so you're asking him to relax those muscles. So one of the things we didn't do and we're not going to do is rotation of his limbs. We're not going to do that, but that is the next thing you would be doing. You would work with his back and his abdominals, et cetera, but that's enough for now. So you might ask him to move around for you and tell us what you see. He's going to be a little one-sided. Maybe we don't want him to move around yet. We'll just take your word for it. Oh, she's going to show. Marilyn.
I was wondering whether you might have a reference for me to do some physiotherapy with my dog. The vet said not to allow her to go up and down steps.
Yeah.
And she said not to. She plays with a much younger dog, and she said for a week or so not to let her run around or because of the pain that she's having. She actually had some problems with coordination of her back legs. That's why I took her to the vet.
I'm sure she did. Marilyn, if you want to talk with her on Zoom sometime, I would be happy to do that with you.
Okay, I appreciate that because I'm afraid of hurting her. That's the thing.
I know. So this is extremely gentle. You go only as far as she can go.
Yeah.
Bronx could go way farther than you would want to go with your dog.
Yeah, Bronx is 9 months.
Wonderful. He's so good. So that's an example of, can a young dog do it? Yes. Can an old dog do it? Yes. You just work with what they are able to do. You work within their comfort zone. So Patricia, did you have any effect with your dog?
Mine wants to play, so it's hard to, he gets like very excited when I try to move his leg or whatever. So I gave him a couple of treats, and he wanted more. But I will try to watch all the exercises you give me and teaching Giselle.
So if you want to email me at,
Yeah.
anybody want to email me at criswell@sonoma.edu.
Okay.
SONOMA. I will send you the canine protocol.
Oh, great. Let's write it down.
Yeah,
Wait a minute. It's Chris.
Criswell. I'll write it in the chat.
Oh, I was
Okay.
just gonna say, I'll do it in the chat. Criswell@sonoma.edu. Yeah.
You
Of
know,
course, I can't find a pen.
Carl Safina. I also put the
Okay, Criswell's at Sonoma ADU, right?
Yes, it's in the chat now, and Giselle
Yeah,
is
I have it. Thank you,
the author of the book.
Elenor.
canine Somatics protocol. And so you have a sense of how to do it. So if you get the protocol, then you can very gently, be very gentle, because you're working with your dog's brain. You're not working with your brain. If you go too far with it, you will be, or too firmly, or too much asserting your own will, you will be working with your brain and not your dog's brain. So we want to work with our dog's brain.
What about cats?
Cat.
Elenor?
You can work with a cat if your cat is used to being handled.
Yeah, here. There, one is more willing to be handled.
With your cat. With a cat that's not used to being handled, you have to do it in passing. So here comes your cat walking by. Take a limb and do a little bit with it, and the cat's gone. And then
Okay,
comes by, do another little bit with it. You can do it kind
all
of
right.
in passing. But a cat that's been handled, you can do the same thing with them. Just be sure it's slow, because if it gets faster, it will trigger stretch reflexes and they'll have to do something like get up. And with your dog, you'll be able to sneak it in when your dog isn't in a play mood. And
Okay,
probably get used to the fact that when you're doing this, it doesn't mean let's play
okay.
something else, because they don't know what it is until they experience it.
All right.
How are you feeling, Giselle, having done that? What is your feeling?
Feels pretty comfortable with it. And yeah, you do feel a sense of stiffness on the other side versus one. And he even was more trusting with me, even being on a chair.
That was incredible. That was very incredible. Shows the relationship that you have with him. But what are you feeling like as a human being?
Feeling well, it's nice. And one of the things that I do want to train him is to be a therapy dog, to be able to sit with anxious individuals. But sometimes I do realize that I try to take him out and he gets a little bit more anxious.
Mhm. This really helps decrease anxiety, because the more anxious you are, whether you're a dog or a human, the more you feel things triggering anxiety. The more stimulation in the environment takes you the next step toward anxiety. So the more you can quiet that down, the more he won't be as anxious in different situations. Well, he's young, he just needs to experience a lot of things
Yeah,
and that they're okay and all that.
I find this so interesting because one of the things I've been noticing about my cat is I always called it the mommy stretch. When he first wakes up, I like help him stretch his arms back real hard and stretch. And now I've noticed he'll come to me, like he'll crawl up on me and use my shoulder to do it. And he like asks for me to do it for him. So when you mentioned that, I was like, oh my gosh, he does that.
Yeah, that's great. So he'll be ready for you to go this next step. Here's a cat, Patricia's cat. Yeah, very good.
And he loves to be held. He's like one of those cats. He's like a little baby. Every morning I carry him around while I get ready.
So Patricia, you'll be able to do a lot with your cat. But cats are really good at keeping their bodies supple. And how old was your cat, Eileen? How long did your cat?
There were two, and both have died. Both lived to be 25 years old.
Yeah, that's quite
Really old. Shadow died at 14 of congestive heart failure, but Crystal had been run over by a car, all kinds of things, and she lived to be 25 years old. Amazing creature, yeah.
So are there other questions here from people? Eric.
First, Elenor, great work. And also it reminded me really of the work by Ed Taub for hand warming, that it's really the sensitivity in the person. And in many ways, I think, especially with, I thought you made this great discrimination between predators and being prey, that working with horses or other animals that are prey, that it really is a remarkable training technique to teach people to increase sensitivity, because really the animal is the feedback device. And for clinical practice, I think it's probably, we probably want to do that much more with children. It's also fun, but the animal can almost automatically, you can see the pattern. And that is just an observation. I thought, and your pacing, I thought was just I was truly intrigued in all of your work. The question I had on the demonstration with Brock is that what it looked like that for me, that Brock was somewhat fearful in the time standing initially, because the base was almost too small with the spine being slightly up. I don't know if that's a factor.
Oh, it absolutely is a factor. Absolutely. And in fact, it's remarkable that he could do as well as
I
he
know.
quite blessed.
Well, the other final comment is that I think I was truly impressed by your fine observation. It's a skill set which so many of us have not done, looking at bodies. And I think the descriptiveness is training, I think, for any therapist. I think just learning to be able to look whether the base is narrow, wider, or all these patterns are cues which are identical for human beings. And I think as a training piece, maybe you should spend more time doing it because it feels less threatening for people to develop that training for students or for anyone.
Yes, it would be wonderful. It enhances so many things, Eric, including getting a sense of the social nature of the horse and how responsive they are to each other, and the communications, very fine communications, facial expressions, and breathing patterns. And Eileen.
I just wanted to say that, Eleanor, of course, I'm always so impressed and charmed by your work. And when I read about the Hurricane Katrina and all of that, and then the animals that are left.
I
And
know.
now with all the migrations, animals deserted, animals abandoned, we're rescuing animals. We don't really pay enough attention to the trauma of the animals
Right.
that are the consequence of our human wars and climate change. So it's just so important to include them in our world, I think, and that we're not separate from them. What happens to us happens to them, vice versa.
Vice versa. So when you have traumatized animals, their effect impacts on the humans. Yes, the humans are feeling better, but the animals are still traumatized. It has an effect on us globally. So the more we can do to help, the better, to help the other animals, both to see if we can prevent some of the trauma that they come in with or have in their lives, and also to help in the case of disasters of various kinds.
So for people, I don't know that when we put this on Facebook, people have access to the chat. Can you say again how people can contact you, just to say it? So, or spell the access to the DVDs you spoke about?
Okay, so there's the canine somatics. In fact, you can Google it, or Google canine somatics. You can find it, but you can also email me at Criswell with a lowercase c, Criswell, Criswell at sonoma.edu. And the more you can share this with people, the better. With people who will work with dogs or cats or horses or other animals as well.
I just wrote that information in the comment section of our Facebook.
Oh, good.
Good.
Thank you.
I wanted to thank you too, Eleanor, for also the music, the tone, and your use of the prosody, and I found that very impressive. And I had in mind all these stories I'm hearing in the recent 2 weeks about people finding ways to comfort the dogs under rocket fire and when in the silence. So dogs react in different ways, but it has been very moving to hear how dogs can comfort their people, and how people find comfort items or find ways to calm down even when there are many sirens or explosions, which obviously dogs do not like at all, like no one does. Yes. I thought that your work is very relevant also to finding ways to work with trauma using that rhythm and pacing and leading.
Yes, absolutely. I'm getting a vision as you're talking of the possibilities of what we can all do as we work together with it. Eric.
think that the nicest part, I think, for many people is that they can do this to help their animal or to, because many people have caringness and they don't have to label themselves to be patient,
Yeah.
which is so antagonistic for many cultures and many people. Because once you have to label yourself, I'm a patient, I'm sick, I have anxiety, then I'm a less than normal human being. And now you do the treatment, and that's what I thought what biofeedback often did too. You do the treatment as almost like the person is a student, and
Yeah.
therefore they have much higher self-esteem.
I like that. And you know, when we're working with horses somatically, the owners frequently say, you know, I think I need this. Tell me how to do this with myself.
I just want to do a time check. Brittany, are you handling this? Because we're supposed to be done by 10, so maybe we should just look for some wrap-up questions, comments. Yeah.
I wish I could have your training. I love animals. I have two male cats and one female cat, recently adopted Teal. And I use my cat stories in my office with my patients, teenagers, and even with adults when I talk about them and try to break the ice. We say it in Spanish, cortar el hielo. And they smile and tell stories about human learning and animal learning and how we are so similar in the basic emotions, depression, anxiety.
Yeah.
And so how my animals cope and recover from anxiety and depression. And so they get to understand themselves, right? And also, when parents ask me, my kid is asking me for a pet, should I get a pet? And I said, would you like a pet? Because many parents think that pets are gifts. And I explain them that pets are family members and the adults have to take care of them. And kids learn how to handle the pets with us as adults and give us so much joy, but a lot of responsibilities.
Yes.
So,
yeah. So if
and please, is there a way to get your training here in Spain or somewhere?
is, but so we do our trainings on Zoom now, so you can very easily take it in Spain. And for example, the equine training, there were 2 women in South Africa, someone in England and Scotland, parts of Canada, parts of the United States, Japan.
Wonderful.
Some of ours, Japan, Korea, China, and various places that people join in.
So shall we write to you an email and ask for the information?
Email me.
I want to thank you also. I mean, during this past year and a half, my dog has become my significant other.
Yeah.
And the other person living in my apartment with me.
Yes.
That is just so sad now, seeing her suffer. And I'm looking forward to getting information as to how I can help her overcome this problem.
Let's help her. And it's thrilling. Actually, it's thrilling to experience them transforming. It's just very touching and thrilling. So I've enjoyed so much sharing this with you. And Giselle, it was so valuable to have Bronx be our demo dog. Bronx
I really do appreciate you. Thank you so much for giving me that experience with Bronx.
Yeah.
I feel like I'm more connected with him.
Yes, and that's the thing that happens. It increases our bonding, our connection with our pet, even though we're pretty connected to start with, but it's even another layer of connecting. And they have a different connection with us. They have the feeling that we understand them more. And that's very
Mhm. Absolutely. I totally agree with you. And I really do appreciate the time you spent with us today in our roundtable.
my pleasure. Eileen, thank you so much for inviting me and inviting me to talk about this.
Thank you so much, Eleanor.
Thank you.
Thank
Been a
you.
great time.
Bye-bye.
Bye-bye.
Bye.